Hey all, welcome back to the Real Life Pharmacology Podcast. I'm your host, pharmacist Eric Christensen. Thank you so much for listening today. As always, go check out reallifepharmacology.com. Subscribe to our email list there. Simply with an email, you'll get access to a free PDF. It's 31 pages on the top 200 drugs, some of the most important things that I've seen in clinical practice, as well as things that'll likely show up on pharmacology and board exams. So great opportunity for students as well as those just looking to refresh their medication education in practice. All right, the drug of the day today is Guanfacine. Brand name of this medication is Tenex. Other brand name medication you might see is Intuniv. This drug, its mechanism of action is an alpha-2A receptor agonist, and it primarily works in the central nervous system, and it reduces sympathetic outflow. So remember, when you hear sympathetic, that means the fight or flight response, right? Where we got an increase in blood pressure, heart rate, things of that nature. So this drug is going to reduce that, and it does it by ultimately kind of reducing the effects of norepinephrine. So that's going to lead to a reduction in vasoconstriction, which could lead to lower blood pressure, and also a reduction in heart rate. So as you could imagine, this medication, with its mechanism of action, is very similar to clonidine, which I believe I have covered in the past. So if you want to listen to that, go check out that previous episode at the website, reallifepharmacology.com. Mechanistically, in ADHD, which this medication is probably where I've seen it used the most, that binding of alpha-2A receptors in the prefrontal cortex is thought to kind of improve that behavioral inhibition in ADHD. Mechanistically, it's not very well studied, in my opinion, with regard to how it works in ADHD, but it has been shown to be effective there to some extent. So uses, hypertension I mentioned, and then ADHD, of course. This is not a first-line medication for either of these diagnoses, as you could imagine, because you probably don't see it very often either. But focusing on ADHD, where you might see this medication, is if you've got somebody that doesn't want a controlled substance. So, the stimulant medications like methylphenidate, for example, and kind of associated with that if there's a concern for drug diversion. So guanfacine may be a consideration there. Another consideration where it may be advantageous to use guanfacine versus other ADHD medication is if patients have tics or Tourette's syndrome in association with their ADHD. Dosing, let's chat about that a little bit. So in pediatrics, we're going to be following weight-based dosing, which is pretty common. I'm not going to list out all the individual weights and doses. I think that's important, not important to have that detail. If you need that information, definitely go look it up with the drug. There is an IR formulation, so an immediate release formulation, and an extended release formulation. Extended release formulation is a little bit more expensive, at least in my experience. The downside of obviously the immediate release formulation is you got to dose it multiple times per day. So that's the big issue there. All right, let's talk adverse effects a little bit. So I alluded to a couple of effects that can happen when you know the mechanism of action. So again, reducing that kind of fight or flight response, the sympathetic outflow, that can reduce pulse. That can reduce blood pressure as well, which, obviously reducing blood pressure is a good thing if we're actually, managing hypertension. But again, this drug is so seldom used for hypertension because of adverse effects and lots of other agents that are much, much better. Other adverse effects that kind of associated with low pulse, low blood pressure, so AV block has been reported certainly. Syncope, dizziness, reducing that sympathetic nervous system action. Obviously, we can cause some sedation and drowsiness. There's also other rare reports of other central nervous system changes as well. Dry mouth is something that has been reported to a significant extent, so that can be kind of a bothersome nuisance symptom. I always pay attention to patients who are taking, biotin or any type of saliva substitutes. That definitely reminds me to go look at their medication list and say, hey, what medications are they taking that's causing a significant enough problem that they feel like they need to treat their dry mouth. So just a little kind of polypharmacy prescribing cascade pearl there to pay attention to those saliva substitute type medications in identifying dry mouth as a potential adverse effect. There's also been impotence and some sexual side effects that have been reported as well there. Kinetics. So CYP3A4 metabolism is important, as well as this drug is significantly eliminated in the urine as well. So it's fairly close to a 50-50 split. So naturally, when we talk about drug interactions, which I will coming up here, that's going to be important with the liver metabolism there. Some differentiating factors with kinetics. So the immediate release, that time to peak is 2.6 hours. The time to peak for the extended release is on average 5 hours. So I think that, lets you know that it's a little bit smoother peak with that extended release, which is, virtually true in all the cases, and why extended release formulations can be advantageous. Also, I wanted to mention bioavailability. The extended release formulation is significantly less bioavailable than the immediate release formulation. So what does that mean in practice? Basically, don't do a one-to-one switchover, is what that tells me. Or at least if you're going to consider that, you better recognize that depending upon which one you're switching to, you're going to give more or less of a dose than you might think you're giving. So that bioavailability figure is really, really important. So immediate release, approximately 80% bioavailability, and the extended release is in the range of 50 to 70% bioavailability. So that's really, really important to recognize that less of that extended release product is going to get absorbed. And so on a milligram per milligram basis, you're definitely going to be off if you give the same milligram dose of immediate release compared to the same milligram dose of extended release. It's going to give you different concentrations, different levels, and ultimately could potentially lead to a different clinical effect or clinical outcome there. Important patient education point in regards to managing ADHD particularly. This medication takes a while to work, so the stimulants tend to work a lot more quickly when it comes to ADHD symptoms. Guanfacine does tend to take definitely a couple of weeks, maybe even longer in some situations, for that benefit to start to show up. So patients can get impatient. They take it for 3 days, 4 days, 5 days, not noticing any difference. That's definitely likely to happen, and it's a really, really important patient education point to recognize that we need to take this medication for a period of time for it to start working, similar to SSRIs in depression, for example. All right, let's take a quick break from our sponsor, and we'll wrap up with drug interactions. If you're in the market for any pharmacist board certification study material like BCPS, ambulatory care, NAPLEX, or others, go check out meded101.com/store. We've got a growing list of resources there, updated annually. Lots of testimonials from folks who've used our content in past. So lots of good stuff there where you can help support the Real Life Pharmacology podcast as well. If you're into other things, we've got books for nursing pharmacology. We've got flashcards for anyone taking pharmacology courses. Lots of different links, lots of opportunities for you to help educate yourself and just be better at managing medications or helping patients work with medications. So again, all those links, resources can be found at meded101.com/store. All right, wrapping up with drug interactions. So first and foremost, I think about the additive effects. So it does have, guanfacine does have some CNS depressant type activity. So naturally, any medications, sleepers, opioids, alcohol that have sedative properties can have an additive effect and really zonk people out. Lower blood pressure, lower pulse. So if we've got other medications that are on board that can have these effects, guanfacine, adding that, starting that, increasing that will increase those effects potentially. And then we've got to mention CYP3A4. I alluded to it, that it is significantly metabolized by CYP3A4. So drug interactions are going to be there with this medication. Kind of a classic kind of drug-food interaction with CYP3A4 is grapefruit juice. Grapefruit juice inhibits CYP3A4. That's likely to increase concentrations of guanfacine and ultimately the effects of the medication as well. On the flip side, we've got lots of CYP3A4 inducers as well. Cyclobenzaprine, for example. Rifampin's got some activity there. Plenty of those medications too. Inducers are going to lower concentrations of guanfacine and increase the likelihood of treatment failure and or inadequate concentrations. All right, well, I think that's going to wrap up the podcast for today. Hopefully you picked up some practice pearls on guanfacine. If you did, do us a huge favor, leave us a rating review on iTunes or wherever you're listening. Support the sponsor, meded101.com/store. We've got crossword puzzle books. We've got polypharmacy case studies. We've got drug interaction stuff. Lots of educational tools there for anyone working with medications in a healthcare profession. So go check out all those links, meded101.com/store. Support the sponsor there. If you have any comments, questions, concerns, don't hesitate to reach out to me, Eric Christensen, PharmD, BCPS, BCGP on LinkedIn. Otherwise, you can email me directly at mededucation101@gmail.com. With that, I'm going to sign off for today. I thank you so much for listening, and I hope you have a great rest of your day.